There is a enormous amount of confusion, and especially when we speak to our friends both in medicine and in the media all over the country, they are almost justifiably confused. That is what is happening in Bengal, because Bengal is almost, West Bengal is almost instinctively combative with very many schemes, very many approaches of the central government. And one of the combat areas in which West Bengal seems to have been arm wrestling with the center is regarding the health scheme. The central health scheme of Ayushman Bharat as opposed to West Bengal health schemes of Swastha Sathi. So we try to clarify to you, because much of the conversation that keeps on happening is in Bangla, and we go on dissecting, we go on analyzing, we go on criticizing, we go on pleading. But if the fundamentals of this debate does not reach to the All India audience, then we just end up preaching to the choir. Now, Ayushman Bharat is a central state scheme which was intended for 30% of the population. A certain number of families were subscribed to it, and it was catered to 30% of population who are below the poverty line or somewhere in the edge of the poverty line. And it provided for a certain amount of health care to the 30% of population who were below the poverty line. And this was not just a very, very broad categorization, but along with it, the schedule of the last economic census was adapted, and that has another 11 or 12 points of exclusion. If you have a refrigerator in the home, if you have a fan in your home, you have a mobile phone, all these apparently absurd at this point of time, which are supposed to be indicators of the fact that you are not poor, but you are threatening to be unpoor. So if you had any of these indices of being unpoor, then you do not qualify for Ayushman Bharat. In the beginning, Ayushman Bharat was even more confusing, even in the states in which it was implemented, because beneficiaries were not sure. If you were faced with the problem, it was mainly applicable for hospital treatment, mainly applicable for operations. It did not do people a lot of good as far as outpatient treatment was concerned. But supposing I was advised to have a gallbladder operation and I'm really strapped for cash at this point of time, I wanted to use Ayushman Bharat, then the point is, am I absolutely sure that I am an Ayushman Bharat beneficiary? There has been a system of distribution of Ayushman Bharat cards, but it has been confusing, B, it has been non-uniform, and different BJP ruled states have had a different take on this issue. Either you have a hint that you are a beneficiary, or if you are lucky, you may have received a card stating that you are a beneficiary. So in summary, it does not apply to 70% of the population. It roughly applies to 30%. Ambiguity about who is a beneficiary. If you have received a card, fair enough, you know where the land lies. So that is the fundamental feature of Ayushman Bharat is concerned. Now what happened in Bengal? In West Bengal, ever since 2011, since the present Trinamool government came on, there was mumblings in the air, because Trinamool government is as far as their economic policies is concerned, they are not just left of center, they are very left of center. So basically, and if you are critical of this government, you will say it is not about productivity, but it is about giving dole. So whatever may be your take on the story, so we rambled around somewhere, and around 2016, once again for a limited segment of the population below poverty line, families who are in the rural sector, beneficiaries, through the women Now, one interesting fact was that families were identified through the women. And most of these women were either in low paid government jobs or they were like healthcare ancillary workers, helpers like your Anganwadi workers, Asha workers, etc. So, financially challenged segment of the population were identified through the women, and probably at best this scheme reached at that stage to not more than 8 to 10% of the families or the population of the state. Now then came the blast, and that blast came to us somewhere in preceding the 2021 elections. The 2021 elections were held in the month of April, May. Sometime in the preceding November of 2020, this scheme was given a complete upscaling and overhaul, and Swastha Sathi the scheme was made available to the entire population of West Bengal. It was de-linked from your income status. It did not matter whether you were in the footpath or you were a millionaire. There are not many millionaires in West Bengal anyway. So we attempted to reach out to something around a population of 9 to 10 crores. So it is not a matter of 30%. It is a matter of the entire population, identified via the women in the family. The woman in the family was given a card in her name, and tagged onto the card were beneficiaries, which included the lady's parents if they were alive. So, in the whole conception of the scheme, there were a lot of good ideas. And if you look at the 30 odd states of India, the 15 major states of India, this was the only island of universal healthcare in India. If you look at Maharashtra, Karnataka, Kerala, Punjab, Andhra, Telangana, no one has an across-the-board universal healthcare. Fine, brilliant, aspirational. We were a little bit of a European aspirations in the middle of Southeast Asia. But did we have the resources to fulfill the dream? Now this is the question where the scheme is faltering. The average per capita spend on Indian right now is around 3,000 rupees per year. About 1,200 or 1,300 comes from government outlays, the rest comes from out of pocket, and as you all know, the out of pocket expenditure in India is prohibitively high at around 50% to 60%, depends upon the state. So if the government of West Bengal is ambitious enough to take over the entire healthcare expenditure of each and every citizen of the state, then 3,000 into 10 crores gives us 30,000 crores is necessary as a healthcare outlay for West Bengal, and scraping all the barrels from everywhere, we do not see West Bengal allocating more than 12 to 14,000 crores absolutely at its maximum possible level. Even at 12 to 14,000 crores, it has got one of the highest percentage spending, state GDP spending of healthcare. So, the million-dollar question at this point of time is, who's going to fund the other half? And that is a question to which we do not have the answers. So the bureaucrats, as usual, there is more lack of planning than planning. The bureaucrats have taken the easier way out. There is a mixture of absurd rates. You are supposed to deal with a critically sick person on the ventilator with all cost of medicine and everything added together at 4,000 rupees per day. Perish the thought. I think 4,000 rupees per day for a critical care cost was probably in India somewhere around the late 60s or early 70s. So those rates are about 50 years out of date at this point of time. And nobody is able to even touch a patient who has any kind of medical sickness. Basic procedures like general surgery, obs and gynae, ENT, ear, nose, throat, most of neurosurgical procedures are completely untouchable as far as these funny rates are concerned. Well, some people have been lucky, the orthopedic rates are not too bad, cardiac rates are just about doable. There is a positive side to Swastha Sathi as well, and the positive side is that wherein people are able to utilize these rates, there has been a big fillip to the number of orthopedic procedures concerned. Cardiac infrastructure is increasing. Definitely, the scale of the cycle of payments of private hospitals has been slow, but payments are coming, payments are trickling in. We in the state feel that it is a jolly good idea. The doctors in the state, I personally feel that this is a make or break option for healthcare in Bengal, which will not only give a stimulus to the healthcare infrastructure of the state, but make it possible for more than 80–90% of the state's people to be treated in the state itself. We've always been banging our heads on the wall that there has been a migration of patients to rest of the country, especially to Vellore, to Chennai and elsewhere. So this in one way is an opportunity. This is a difficult opportunity because this is a great ambition which has been critically underfunded. So it's a difficult riddle to solve at this point of time. The next few months are going to tell us that whether the government comes up with a solution to this business. Does the solution lie in garnering more funds for this program? Difficult, maybe possible. If not, are you going to limit the number of beneficiaries? Well, it's very difficult. You're going to have a hugely unpopular government if you now go on saying that half the people are not included in the scheme. Are you going to allow part payments where people pay a part and the part comes from the government? Well, the healthcare is also not a congregation of saints. People find their way around a lot of things. So implementing that in a straightforward, ethical way is not going to be easy. We are glad that this scheme has come. It has more questions than answers. It has more challenges than solutions. But we think that for a faltering, low growth that has plagued healthcare in West Bengal for a long time, this will be a right stimulant. But we have to be patient, we have to work out the solutions and not live on threats and populism. More and more unplanned populism will be a future impediment to the scheme. So we need resources, we need planning, we need administration. And if you have a head-to-head comparison of Ayushman versus Swastha Sathi at this point of time, I think on paper Swastha Sathi outscores Ayushman Bharat as far as the rates are concerned, as far as the reach is concerned, as far as the universality of its approach is concerned. But definitely it is behind Ayushman Bharat as far as the resource allocation is concerned. And a lot of the administration and implementation is soft and suspect at this point of time. We have a mountain to climb in front of us and hope we are able to do so. Thanks.